Good morning, good afternoon, and welcome everyone to Justworks' sixth installment in the Ask an Expert series on re-entering the workforce. My name is Moses Ballion. I'm a certified HR consultant at Justworks and today's moderator. Just a few digital house cleaning details. Your audio has been muted to facilitate discussion. Questions, we received some upon registration, which we'll address at the end of this webinar, but please feel free to submit additional questions through the chat feature. Through the Ask an Expert series, we allow you the opportunity to ask the expert. And so the whole second half of today's presentation will be devoted to Q&A. As far as follow-up, this webinar will be recorded and sent out by email to all registrants, along with other details for how to register for our next and upcoming webinars. With that, I want to welcome our esteemed guest, Dr. Will Kimbra, Senior Medical Director of Clinical Services at One Medical. Will, thank you so much for joining us today.
Thanks for having me, Moses. Really excited to meet everybody. Just as a way of quick introduction, I'm an internal medicine primary care doc at One Medical with a background in public health, specifically about studying respiratory diseases. So, that's sort of a prime time background at the moment. And, apparently based on that profile picture you just showed, I need to start doing research on either getting a new headshot to share on these things or the aging effect of COVID, because, I don't know about you, but feel like the past 4 months feel like 4 years.
You told me that beard is new, right? That's a COVID beard.
Right, total COVID beard. And some COVID hair, I don't know. It's all sorts of problems going on here.
Well, I'm just impressed, honestly.
So,
well, great. I'm excited to hear about One Medical's approach to care. I could talk about beards for a long time.
Right, I mean, it's, again, like the weird impact of COVID. How much time do we spend talking about working from home, virtual backgrounds, and haircuts, right? But if it's all right, I'll kick us off a little bit by just talking about One Medical.
If you must, sure.
How we think about our approach to COVID, but also primary care in general. So just as a starting point, One Medical, we've been around for over a decade. We're a national membership-based primary care practice. We've got practices in 12 cities across the country, and tools for virtual care, tools for mental health. And with the pandemic, we pivoted and leveraged a lot of those tools to be able to better address the COVID problem. So, using the tech platform, using our providers in office, using our virtual providers, it really helped us quickly shift to meet the needs of the communities that we serve and across the nation.
Great, thanks for that introduction. With that, I want to move on to today's agenda, what we'll be covering, and that entails which measures employers should be considering as they develop their return to work plan, employer resources for testing, care, and clinical recommendations available from One Medical, as well as how employers can deliver the right information about COVID-19 to their employees, and of course, the much lauded and anticipated Q&A. Will, I'd love to hear more about innovating as far as providing care and support during COVID-19. I've been a One Medical patient in the past, have nothing but wonderful things to say, and would love to share with others those details as well.
Sure. So one of the big things throughout sort of the COVID crisis over the past months has been just how quickly the information evolves, changes. We can think of several examples where we were told one thing, or we heard one thing that was published in the press or even by the CDC or FDA that then changed, within days, weeks, sometimes just hours. And so that's one of the big things that we see ourselves as really helping navigate as healthcare providers and public health experts, is by ingesting all that information, making it more digestible, more accessible, but also super up to date. So, basically just staying, our fingers on the pulse of what's happening in the world of COVID, so that everybody that we're partners with has the most up-to-date and useful information as possible. As I mentioned earlier, because we have the tech platform, we've got several different ways to help support both individuals and employers. That includes a Treat Me Now, which is an app feature where basically if you think you have any concerning either exposures or symptoms of COVID, we're able to quickly guide people through it, get them in touch with the provider if they need sort of a chat or more live interaction to figure out what the right next steps are. 24/7 on-demand virtual care, and then also schedulable primary care visits with our primary care team. And then also our amazing ops team has been able to stand up outdoor and indoor testing facilities in all of our markets. And that's for both the PCR, so sort of the nose swab and the immediate viral test, and antibody testing with either same day or next day appointment availability in all of our markets. So it's been a lot of new things that we weren't doing a few months ago, but again, using sort of the existing tools and expertise that we had as an organization ahead of time.
Absolutely. Prior to COVID, I'd been into multiple One Medical offices, actually, with wonderful experiences, excellent and punctual care, beautiful spaces. And then following the COVID-19 isolation, I started developing symptoms of the virus and was able to converse with One Medical on the Treat Me Now app, get some great personalized recommendations. Haven't been able to get an antibody test yet, but being a New York City resident, was pretty sure that's the situation I was in, and received a lot of comfort and guidance through that. So I want to thank you personally as well.
Sure, really glad that it worked out for you.
Thank you, Doctor. Seriously. So what we know, what we don't, reading between the news headlines, making sure that we're up to date with the latest scientific guidance, navigating any potential political obfuscations that might arise too, right?
Exactly. And, this really just gets back to that concept of uncertainty, right? Like, even, if you follow one study, there's often another study that comes out later that contradicts it. And so, what we really value ourselves as a partner to be able to help navigate all this uncertainty and change as things go. Because, if you just whipped to follow every single directive or, request, basically you'd be changing and, seeming really inconsistent. And there's some really solid science, just and reasonable knowledge about coronaviruses in general, from decades ago, that we're able to apply to this new one to sort of help steer us towards, which direction's the right direction to run in, which ones, should we wait for more information. And at the end of the day, the bottom line is this is a new disease with all of 6 or 7 months of data behind it, and so there's still a lot of unknown. But we really do have a lot of pride in being able to help understand and navigate and digest this information as quickly as possible.
That's huge, navigating overwhelming information. So when in my context as an HR practitioner, there's been a lot of talk of return to work, which sounds like a very binary dynamic. So you have this amazing metaphor of the light switch versus the dimmer that I'm excited to hear more about.
Sure. So, of course, when everything went into lockdown a few months ago, it felt like a light switch just getting flipped off, right? And and in the sort of natural, normal sense of optimism, most people are thinking of, shelter in place is ending in a lot of places, flip the light switch back on. But the reality is it's going to be a lot more like a dimmer, where it can and should be a very gradual, staged approach, and it might not be one direction. It might need little steps back at time to adjust and to react to outbreaks or increasing rates of virus spread. It's also important to remember, which I think we're seeing a lot of at the moment, that one city might have a very different experience than another. So and using New York as an example, obviously a couple months ago it was a very different experience in New York than in a lot of other parts of the country, and it's going to continue to be that way for the coming months in terms of just where things, which cities have more cases than others, higher risk. But also, again, thinking of New York, there's going to be more people who've had it and might be a little bit protected with some antibodies and less vulnerable towards reinfection, all those things. And so rather than getting simpler, I'm afraid it's just going to get more complicated as we think about the different geographies and factors that go in there.
No doubt. And I'm sure there'll be some diversity with respect to industries as well. And that brings us to your next point as far as recommendations moving forward.
Right. So, and again, this sort of gets back to that natural optimism that a lot of people have of like, all right, well, shelter in place is over. Let's go. But the reality is a lot of this people that are most at risk because of COVID are going to remain at risk for the foreseeable future. And so, just with, with respect that, a lot of industries have different ability to do this, looking at it through the lens of keep helping people find ways to work from home, if at all possible, especially people who are more at risk of complications of the disease, is a really important public health measure. It's not just about the individuals or the business, it's really about the community and, and us as a whole. As frustrating as that is, because vaccines do take a good bit of time to develop and all those things, but knowing that that's not reasonable for all businesses, all individuals, all industry types, we're really here to help think through what framework might be applied to help reduce the risk as much as possible. And that's an important concept, is it's about risk reduction, not risk elimination. So, at least a couple months ago, I saw several mentions and articles about the idea of COVID-free or COVID-safe. And luckily, I haven't seen those lately, because I think the concept has sort of gotten through of like, okay, all this is risk reduction, not risk elimination.
Certainly. Through this time, we've all had to develop some comfort with ambiguity and constant change, accepting the things we cannot change and focusing on that over which we do have control. So that's very sage advice. So when we look at supporting employees going forward and gradual return to work, let's break this down into the 4 categories of preventative measures employers can take.
Sure. So I think the CDC said it really nicely, which is if you don't have measures in place and sort of a thoughtful approach as a business, it's probably not time for you to start bringing people back yet. And that includes just having a plan, thinking of workplace density, how can you space people out as much as possible, depending on your situation, like do you need to provide personal protective equipment for your employees, all those sort of steps of like, is the actual space itself designed and thought out in terms of risk reduction there. The next level in our clinical opinion is about actual screening and testing for workplace reentry. So basically thinking of, all right, if you know that there's a group of people that you want to bring back, how do you arrange for pre-screening, making sure that they don't have ongoing exposure to somebody that might have COVID symptoms, if they're traveling to areas that have high rates of COVID, just basically making sure that you understand the underlying risk of people, providing testing just as another way of further reducing the risk of somebody coming in, especially with asymptomatic or silent infections. And then once you have that group identified and sort of pre-screened, then kicking in a daily attestation. So the way we think about it is, if we're able to ask people at home before they leave in the morning every day, how are you feeling? Do you have any new exposures, any new concerning things? It really keeps people, out of public transportation, from, punching all the elevator buttons on the way into work that day, all those things, and shifts the accountability as far downstream as possible. Again, thinking of it from a society standpoint. And then, because we are a primary care organization, of course, we can't help but think, and what about the mental health and, just the behavioral well-being of everybody involved? This has obviously been a really stressful time for everybody. And so, just thinking, how do you best support your teams through that lens as well?
Great. Thank you so much, Will. So there's been a lot of talk about temperature screenings getting probably a huge bulk of the attention. So you have this great visualization here, layering interventions to reduce risk, of which like temperature checks are one of many, many, many procedures to implement. So I really appreciate that contextualization.
Totally. And I will flag, so the daily symptom screening, if you can do that with your employees at home rather than waiting for them to actually come in, it again reduces all that risk of the transit time, of them actually being in the space at all. And temperature checks by itself, it does a surprisingly not great job of identifying people with active COVID infections. The best numbers I've seen are that it works about 35% of the time. And so, which again, just sort of feeds into this idea, everything's just a little segment. There's no one thing that takes a big chunk of that risk by itself. It's all about incremental, stepwise risk reduction.
So I just want to be really explicit about this. When we talk about symptom screening, that's an employee self-reported questionnaire as far as their symptoms and potential exposure?
Right. So through the One Medical app, basically each employee gets a daily reminder to fill out. And more or less it's check your temperature and just pause for a second and think about how are you feeling today. Just because if people are in a hurry or not really dialed into themselves, maybe you're running that low grade fever, maybe you've a little achy and just a scratchy throat, and unfortunately some people with COVID, that's the level of symptoms they have is really vague stuff.
Mm-hmm.
And for the most part, most of the employer partners that we're working with, the idea is that you want to be pretty risk adverse on people coming into the office if they're not feeling well right now, rather than risking people with sort of even low grade infections coming in and potentially being contagious.
No doubt about it. And I know we talked before about potential employee exposure to people who have tested positive. And when you don't ask these explicit questions of people, like, have you been in contact, for example, you leave it up to the employee to take all of this disparate and kind of amorphous data and make a decision as to whether they should come into work that day. Whereas when employers are explicit, they have an important role to play in mitigating risk as being the sort of more informed and centralized party.
Definitely, I completely agree with that.
Well, let's talk about how this infuses with culture. Culture is sort of implying learned behaviors on behalf of employees, and how will we impact behavioral change?
The way I really think about this is through the lens of behavioral economics. This is obviously a hard time, right? Because again, a lot of people think of the light switch going back to the way it was, and the idea of normal. And obviously, a lot of things in the workplace aren't going to be normal the way that they were in, let's say, January. And so the more sort of structured and easy to follow a workplace is to be able to maintain social distance, maintain one-way traffic flow, not, you use a bare hand to open every, door and every little thing in the shared space. Like, the easier you can make that for your teams, the less cognitive load it'll be for them to sort of stick with the rules and not feel overwhelmed and alienated and just pressured about because it's already going to be a lot, masks, hand washing, no high fives. I mean, come on, no high fives, what happened here? So yeah, that's the way I really think of a lot of the design in terms of the workplace is how do you make this as easy to follow as possible so that it's not as off-putting and as just taxing on the individual to keep remembering what the right rules are to follow.
So rather than a rule book of regulations to memorize, which maybe you do want to have, I love that. Reducing the mental load for employees to make these new learned behaviors more intuitive and having your physical space inform that's profound. I really love that. So as we look at cities and regions reopening in phases, as should employers consider a similar approach. So what might that look like?
Right, so this really reflects the CDC guidance that we see happening in a lot of the cities we're in, right, of sort of phases and stages. And the idea is if you bring back groups, maybe based on role type or based on even individual desire to be at work, however you design these cohorts, if you start bringing people in, it really helps you control, you can test each group before they come in so that you know that no one's coming in with the silent or asymptomatic infections, and sort of just helps control the pace of things so that, if you just bring large groups of people back all at once and you have a little outbreak, it becomes a lot harder to understand, was it somebody actually from that, which group was it from? Was it from outside in the community from their commute, or was it, from actual spread of the disease in the workplace, and everything just gets muddier and harder to suss out. So we really think that a staged cohort group-based approach is a cautious but appropriate way to bring people back into the workplace.
That's great, Will. Thanks for that insight. So we've all become mini experts on COVID, on testing, what the new landscape looks like, but really want to break it down that there's these two testing methods, PCR and antibodies. So tell us more about the distinction.
Right, so I would say especially for workplace reentry, the PCR one is the backbone of the idea. And that is, it's either nose swab or throat swab. It's the one that's looking for active at that moment infection. So, this is the one that lets you know who might be contagious in the workplace. There's lots of available options, many of them the same or similar, high quality. And it's the one that's really going to help reduce the risk of somebody being in the workplace that shouldn't be. The antibody testing is really more around the concept of who has been infected previously. And we're optimistic that, in the coming months, there's going to be enough data to really be able to say that antibodies, or some level of antibodies, means protection for some period of time against being infected again. And at that point, it'll be a little more useful for thinking about workplace design and who might work with who else and all those things. But it's not quite, the scientific backing just isn't quite there yet to interpret it that way at the moment.
Got it. So scientific information forthcoming. And of course, as things unfold, infection rates increase, decrease, we'll learn a lot more as time goes on. Great.
Absolutely.
You emphasized at the very beginning the importance of daily check-ins. So what are some best practices for employees amidst that arrangement?
Right. So again, just really getting into how normal it is in June, July 2020 for employees to check in before they come to work. And so it's really about making a culture of individual, but also collective community responsibility. So if someone's not feeling well, it's really their contribution to society right now to stay at home until they're feeling better. So what we're able to do is, if somebody does say that they have symptoms or risky exposure, our clinical team's able to reach out to them. If they need an office visit to get checked out to make sure it's not something more serious, we can arrange that. But also if they need testing, we can help arrange for testing quickly for them in that setting as well.
That's huge. So thank you. Tell us about Healthy Together and how that plays into what we've been talking about.
Sure. Healthy Together is One Medical's sort of combination of all of these tools and approaches that we've talked about so far. So it's just the combination to really help our employer partners that we work with really take those steps. And, and if if they're not all right for everybody, we help sort of implement what is right for each business, each industry, just knowing that everybody's a little bit different and the needs might not be the same for everyone. But it really leverages our in-office providers, our tech platform, and our newfound testing expertise all together.
Nice, great. Well, you talked about the screening. My HR mind is getting pretty jazzed about that for the ease it provides to employees, taking that mental load off, and also the consistency. It's just all the right pieces coming into place. So I'm excited to see some screenshots as far as how this all comes together.
Sure, and I'll move sort of quickly through this to make sure that we've got some time for the Q&A too. But in general, this is the general flow from the employee perspective. So basically, notification to sign up, which would we would partner with the HR teams to generate the right list of people. There is a consent process so that we can share the results and reports with the HR teams just for information sharing. And then basically we line them up to get tested. And all that happens prior to sort of the green light to start the re-entry process. And then on day one, so the first day that somebody's going to be back, that's when it kicks into the daily attestation. And you see there on the far right side a green badge. So basically we've got 3 color badges, one for low risk based on questions plus a recent negative test. There's a blue badge, which means low risk by questions, but without a recent negative test. And then a red badge, which basically is, if you say anything that's concerning enough to get flagged by our clinical team as risky for COVID, or if you have concerning exposure, travel history, anything like that, then we make sure that it's really obvious that it's a bright red color of today's not the right day for you to be at work.
No doubt. Is that something that maybe upon entry an employee would flash to the screening personnel up front?
So we've seen several different applications for it. So if it is a workplace with sort of a controlled entry environment, some people are using it as just an entry badge. Other ones, where it's maybe more of an open floor plan, just managers maybe are making a once a day loop around just asking to glance at people once they're already there, which again gets back to sort of that personal accountability model. And then, we've had other employers approach it from a little bit of a laxer standpoint of just, where they're just looking at the reports themselves every day or every few days to see sort of the general trends.
That's great. I love how an underlying theme here has been placing ownership on employees for maintaining their own physical health and contributing to improved public health. So that's great. Well, I'm excited to say that for our Justworks clients who are in attendance, at no additional cost, you'll now have access to Healthy Together with no change in your contract to Justworks. And so what that includes is One Medical's return to work playbook. Information and as far as accessing that will be sent to Justworks customers in attendance today in our follow-up email, as well as access for gaining the information for gaining access to the Healthy Together app. So excited to share about that. And without further ado, Will, let's ask an expert and get into some Q&A. We did have some pre-submitted questions, which were excellent, and we're going to get into now. So let's start. What are your thoughts on realistic timing for a vaccine, and how do we respond to staff who say that they don't want to return to the office until there is a vaccine?
Again, this not to keep bringing up the natural optimism of people and then me keep being the person who destroys that optimism, but vaccines typically take many years to develop. So when we're talking about the massive government level investment and really fast tracking vaccine development for this, it's a big gamble. Just because when you think about it, if the most likely death rate from COVID is somewhere around maybe 0.5%. And so the vaccine has, any vaccine has a risk of serious side effects, complications, sometimes even death. And so if it's anything even close to that, then, all of a sudden you've got this weird balance between risk and benefit of it. And so the safety of the vaccine is going to be really important. Also thinking of other viruses like a flu shot. So in a good flu vaccine year, the effectiveness of the vaccine is somewhere between 40 and 60% effective. And so the chances of there being a really quick, super safe, and also really highly better than 60% effective vaccine are really unlikely, which sort of leads me directly into the next question of people who want to stay home or stay out of the office until the vaccine's ready. This is most likely going to be like the flu, where even in the best case situation, the typical person's still going to get it every now and then. If the disease just goes into circulation like the flu does, which is reasonable based on just how the disease spreads and everything. So two pieces of pessimism in a row. One, the vaccine might, saying that it's next year is an optimistic timeline still. And, more people who think that they may never get COVID. Unfortunately, lots and lots of people will get COVID. It's just a matter of when and how much, do we have medicines? Do we have a vaccine to help make it milder? All those things. But thinking that lots of us will eventually get COVID at some point.
Sure. Well, I really do appreciate your honest thoughts and perspective. And reality is always more nuanced and ambiguous once we confront it, isn't it? So we're just going to have to foster that comfort with ambiguity as we go on. Our next pre-submitted question is, we've heard that other organizations, the submitter has heard, that are expanding testing capacity to introduce less invasive tests. What's One Medical's opinion?
Sure. So basically what we're doing is we're taking every testing technology and pre-evaluating it as much as possible so that when the FDA signs off on it, says green light, you're good to go, that we actually have some pre-existing information about how well the test is going to perform. And unfortunately, that enters into a lot of the testing options that sort of, especially early on. So for instance, the finger stick antibody kits, they flooded the market about a month and a half ago. Lots of them were quickly available. And then turns out that almost all of them were not very good and subsequently got pulled back off the market. So what we're thinking of is, we don't want to be the last person to offer things, but unless there's a lot of data to support a new testing method really being safe and effective and sort of meeting that same gold standard. We don't want to subject our members and our partners to faulty technology and faulty tests just because that has a lot of potential downside to it.
Yeah, no doubt. So for this next one, sometimes the shortest questions are the biggest ones. So a few bullet points, but what does social distancing look like inside an open office floor plan?
All right, so that is a tough one. So a couple of important concepts just to think through are that, we've got the 6 foot distance sort of drilled into our minds at this point in terms of like a safe distance.
Mm-hmm.
But the reality is it's like sort of a linear graph of risk where, if you're right next to somebody like in their face, yeah, that's the highest risk. But like even at 6 feet, there's a little bit of risk. 7 feet safer than 6, right? And so just thinking through, what's the most reasonable distance you can put between people? What are the other approaches you might be able to take to help mitigate that risk if you do have team members that need to be closer than 6 feet together? Like masks or barriers, things like that. How do you control traffic so that people aren't passing close by each other in the hallways? All those things really enter into it. And then air circulation too. So, a tight, low ceiling office with people exactly 6 feet apart from each other, facing each other, is going to be higher risk than, more open airflow with people sort of offset from each other. So it is a nuanced one, but the idea being since there's no one way to eliminate risk, it's all about how do you make the best with the options that you have to reduce risk.
Thank you so much for that, Will. No doubt about it. The open office floor plan, much in vogue in the last few years, comes with its own set of challenges in navigating COVID-19. So I have some questions that our attendants have submitted I'd love to get into. The first is from Patty Izquierdo. Hi, Patty, we've talked before. How do we minimize legal exposure to the company, and can we have employees sign waivers? I do have some things to say on this, Will, but if you have some commentary, I'd love to hear it.
Unfortunately, just coming at this from the clinical lens, I can't offer much in terms of the legal perspective on this.
I'm happy to say waivers, there's not definitive guidance, but it's generally inadvisable. And part of this has to do with the employer and employee power dynamic of the relationship, what's called bargaining power. And so employers might be disproportionately advantaged to compel employees to sign this. And that's why they've been generally not recommended. There's also workers' compensation laws in different states, which may prevent this. So it's a very sharp legal question. Should definitely run that past counsel before you implement any sort of waivers. I have another question on, this is a clinical question, Will. You probably might not have the answer. Ali Delanoy asks, can you get coronavirus twice?
So there have been a few examples of it, but they're sort of iffy because the nose swab, the PCR test in particular, is so sensitive. It can pick up virus in people for sometimes months after they've been after they've had COVID, and so it's been really sort of hard to suss out whether somebody had a mild case and then had a second mild case, or if they just had one infection that then got picked up sort of intermittently for weeks or months afterwards. But what there is emerging evidence of is that mild cases probably produce lower levels of antibody. So using what we know about most other viruses, that would suggest that it doesn't provide long-term protection against reinfection. So a little bit of it's not proven that it's a concern yet, but it's a reasonable concern, especially for people with milder cases.
Great, thank you so much for that insight. All right, we're going to take one more question in the interest of time. So thrilled to have you today, Will. If your question was not answered, we will follow up with resources on returning to work guidelines and more information on the Healthy Together app shortly after this webinar, so be sure to check your inbox. Our last question will come from attendee Florine Wiley, who asks, can you require your employees to get tested, or is it entirely voluntary on the employee's part or the employer's discretion?
So sorry to claim just clinical knowledge on that one again, but I would suggest checking with legal counsel and just the specific implication of that.
Definitely. Definitely. There's a lot of legal questions to ask here. Be sure to check in with counsel before you implement any sort of mandatory procedure. But Will, we really appreciate your clinical expertise today, and thank you so much for demystifying and isolating a lot of the pertinent information surrounding returning to work and safety in the workplace. So Dr. Kimbra, truly a pleasure. Thank you.
Thanks for having me, Moses. Appreciate it.
Absolutely. Everyone, please watch for your follow-up email. Thank you for attending this episode of the Ask an Expert series. We hope you join us again. Be well and be safe.